Hello, friends of the internet, and welcome to the latest in our webinar series. This one is titled uh, How to Eliminate Silos in Healthcare for Improved Patient Experiences. I'm your host, Joel Vardy, CTO here at Agility, and I'm delighted today to have Gil Bash here with me. He's a champion for health innovation to sustain life and improve health patient care. His energy and efforts center around making it possible for bold ideas to navigate an often fragmented health ecosystem. Gil, welcome.
Joel, I am so thrilled to be with you and Agility CMS today. I think it's a great conversation. Just as an aside to our listeners today, I signed up for your webinar. I think it's September 8th or something, Thursday, September 8th at 11. And I follow what you're doing. I signed up for this webinar, and now I find out that I'm the host of, or I'm the guest on the very webinar I've signed up to listen to. So the topic is fascinating. It's important. And I might say, I hope that the host is equally illuminating as what you and Agility are doing right now.
Well, a lot of great stuff to talk about, and a lot of great insights that I want to kind of pull out of your brain. We've had conversations before, Gil, and I really like talking to you because you really care about people. You're very active, and you've been all over the place. You're actually, are you heading? You're heading somewhere soon to sort of go into the field.
Yeah, I am. Well, I'm doing a few things. First of all, during the last 2.5 years, we've been pretty isolated from each other, and I think that the curtain on that isolation is beginning to raise. I think that's partially because we hunger to be with one another in real life. The meeting I went to, the first meeting I sort of ventured out after I was vaccinated, when the concept of vaccination was, we thought that perhaps it would prevent contagion. Now we understand that it clearly is it's a breakthrough medicine that mitigates severity of impact, and that's important too. It was HIMSS in Las Vegas, and shortly after that meeting, I actually was in Eastern Europe in the Ukraine, and that was a very dramatic time. It's a tumultuous time right now. I'm heading back to that part of the world again in September, and I'm very privileged to be there first in the neighboring country to the Ukraine, where there are a tremendous amount of people flooding in. I'll be there as well, and hopefully I'll be in a situation where I can lend a hand. And I think that all of us really have to look around ourselves, at our neighbors, and people in the towns we live in, the cities we live in, people in rural areas, remote areas where they may not have access to primary or tertiary care centers, and say, what could we be doing as individuals, as groups, as companies? I just want to give a tip of the hat to you and the Agility folks. During this time when we've been so isolated, we have been desperately searching for information and content. And the context of content management systems has become more and more important to us as individuals. And I certainly have been examining the world of omni-channel communications, which you and your colleagues are really in the forefront of trying to pioneer for all of us. And what I've learned is people get information from different paths, and that I think our health system has to begin to appreciate that more and more. Especially in your introduction, we're dealing with a very fragmented health ecosystem. So again, I want to thank you for inviting me to the program and being in conversation with you. And thanks to you and your colleagues for what you're doing to actually create the technological platforms that allow people like myself, health professionals around the world, and companies engaging health professionals around the world to have an easier time really making that what I'll say value-added connection.
Yeah, thanks for that, Gil. And it's really that I think the theme of today is connection. It really seems like that's a theme, in a lot of different kind of universes. And many healthcare institutions, I think, really suffer from this idea of like a data silos that prevent the connection between professionals and all these different systems that we have for sharing crucial information at often really important times. And the result for healthcare professionals and customers, all these users, all these people that need information, is this huge increase in time for things like administrative duties and workflows. These are important things that need to happen, but they take up too much of our time. And we have IT teams that have difficulty diagnosing sort of these potential issues, and then all of a sudden we've wasted time. And sometimes that was really important time that we needed to not waste. Now, from your point of view, what kind of healthcare tech solutions do you think are important from your perspective that we really need to address here?
Yeah, for two parts. One, the question you asked, I want to answer, but I actually want to speak also to your preface to the question itself, which was so insightful. We're at a time where the system is becoming more fragmented, not less fragmented. In the United States specifically, the consumer changes their health provider as often as their employer, in many cases, changes the payer. Keep in mind that a little more than 50% of U.S. citizens specifically get their health insurance by way of their employer, and 50%, a little less actually, get are self-insured in some way, shape, or form. And then, of course, there's a small group, unfortunately, that is in desperate need. Those are the people, by the way, who need health access the most, have it the least, and that's a problem in itself. But with that technology, by the way, and information can help resolve. But what happens is that we have a variety of situations going on. One, we have health systems that don't speak to each other. We have consumers who don't access their health system. We have consumers that are using, understandably because of the convenience, walk-in clinics, where they're going into the walk-in clinic for a very specific need, a rash, a hurt, a pain, an ache, and they're being asked about their health history with a system that has no way of knowing that health history, no way of really knowing what other medications they're taking. And the consumer has the right or the privilege or the responsibility to provide information or make it up as they go along. We're at an age where we are our own health historians. We write our history as we want to believe it is, because there is no other way to find out. So you have consumers going in for an issue, maybe getting a medication that is counterindicated for a medication they're already taking. That's a problem in itself. So when you talk about fragmentation of the health system, it's not just that payers don't speak to providers or product innovators are having a challenge reaching health professionals, and the product innovator probably knows the most amount about that medicine than anybody really knows about that. We have policymakers that are making up policies or having to enforce policies where people who have health conditions are in often cases, because of misunderstandings, denied access to care or denied access to the care that they need. We're kind of in a mess. What can I tell you? We're kind of in a mess. And I do see light at the end of the tunnel, and that's your question. Technology is not a replacement for humanity. Technology will not resolve our trials and tribulations. Technology is a bridge that connects healers with those people who are seeking desperately to be healed. What sort of technologies, you ask? Well, we often think of, I'm sporting my Apple 7 watch. I'm looking forward to the Apple 8. And I'm not talking about that sort of technology. I'm talking about simpler technologies right now. There we go. Simpler technologies, even for people who don't have wireless technologies, who have access to public broadband systems. So some of the systems I think we need to really look at and lean into, Joel, include remote patient monitoring that don't only require sort of like high-tier smartphones, but they just require the ability to look at your phone. We're talking about technologies that can connect seniors who may or may not be challenged by some technological feats to actually be in closer contact with their health providers. We're talking about, in many cases, the use of special patches that allow the patient and their provider to monitor diabetes, that monitor arrhythmia, irregular heartbeats. There are many amazing technologies that are becoming far more convenient and easier to use and more effective in intervening around health problems. And so a lot of our fragmentation is contributing to something very serious, and that is the rise of the sick care system. We've always had a sick care system. We like to call it healthcare, right? We have a healthcare system. But think about it. For those of us in North America, less in Canada, where you're sitting right now happily, but in the United States, which is probably one of the world's largest health markets, we spend 20% of our economy is dedicated, 20% of GDP goes to health. By the way, compared to Hong Kong, about 7%. And they live 10 years longer than we live here on average. So what's going on? What is going on here in terms of your question on technology? Culture. We have a culture of resistance sometimes to the new. We have a culture of resistance to training healthcare professionals how to effectively use digital health technologies, how to use wearables. And that in itself is an illness, because we can invent. We're not lacking innovation. We're lacking imagination of how to best use those technologies. And when you think about a physician who is eager to heal people, and yet they're not given the training necessary to use technology, wearables, smartphones, remote patient monitoring, basics, even how the electronic medical record from the consumer side can be made easier to access for the consumer themselves. Now, something I wrote about, my father-in-law of blessed memory, a physician, he left this world at 97 years old. My wife was speaking to one of his health providers at a wonderful hospital, and she mentioned that a certain aspect of his medical history was in his electronic medical record in the hospital where he had been going to. So it wasn't a difficult aspect to access the information. Mm-hmm. And this person said, candidly, transparently, I don't have time to read his electronic medical record. So that's why I said we're not lacking innovation. We're lacking imagination and facilitation. We're not making it easy for health professionals. And I know that in my recent visit to my primary care professional, I asked her, do you like practicing medicine? And it's a very pointed question. She said, well, no and yes. I said, yeah, that's not very comforting. I know when you hear that from your primary care doc.
Yeah.
So tell me the yes. Encourage me, please. She said, I love helping patients. I love guiding them. I love educating them. I don't like the fact that the bureaucracy of medicine requires documentation on every single point, and that most of my time is spent feeding data into my laptop. She walks around with a movable stand with a laptop on it, right, from patient to patient, which is not uncommon now. We have to invent in a way that considers the users, not the invention. Right. And that's what I see a lot in my travels throughout the world. I travel around the world meeting with innovators. They show me magnificent Star Trek-like stuff, but it has to work in a Flintstone level medical world, right?
Interesting.
We're in the Stone Age.
Yeah.
We're in the Stone Age when it comes to thinking about the consumer as a partner in care, but we're inventing stuff that is light years ahead of our ability to think about the culture of health. The reason I say sick care system before is that our system is really geared toward dealing with the consumer once they're sick. If you really think of prevention of non-communicable diseases, cancer, diabetes, heart disease, respiratory disease, mental health aspects, some of these, a large part of them can be prevented. Technology could be in the forefront of giving us frequent information to do that. I have a system on my smartphone that I use. It actually allows me to look at my phone, and get a blood pressure read, pulse. It checks through my eyes, my mental health status, and so forth. Magnificent. We've got great technologies. Are they standard on the smartphone? I don't know. I don't think so. So I think, Joel, technology is an assist. It can really help. Problem, humanity. Humanity stands in the way of technology, thank God. And
Right.
I think we've got to do a better job in making information available to humanity to inspire them. And I would say, in visiting your company's website, one of the things I really noticed was how you're really, really looking at how do you provide information to your customer base so that they'll be more engaged. That's what it's all about, engagement.
And yeah, I really want to drive into that point a little bit, because to me, that's a really close relationship that needs to happen between marketers who are, because essentially, websites is the information that the world sees on smartphones and wherever. That's
It's your
we're just,
billboard to the world. Totally.
that's right. But the relationship between marketers and the clinicians who are actually actually creating that knowledge, what in your experience, what is that relationship, and how can we make that relationship sort of better, in the idea that we can prevent more disease by providing better information out there and that's, I hate to say marketers, but it really is a marketing kind of a thing,
No,
WebMD or these
I
other
love,
things.
Joel, I love the fact you use the term marketers. Marketers, unfortunately, in health has become a disparaging term. And I think that's why you were kind of hesitant to say marketers. But when you
Yeah.
really think of marketers, marketers who are at the height of their game, the best, are providing authentic, truthful, transparent, timely information that enables health professionals to do their best work. And that's like a tier one marketer. Professionals, health professionals, and policymakers have to encourage those marketers to do great work. Nobody knows more about a medicine or a therapy or a device or an approach than the company, the sponsor of the innovation. They know the most about that product. They're in touch with key opinion leaders. They're the ones who are championing science. They're often sponsoring studies. They don't control the outcomes. Investigators, principal investigators, they're the ones that are driving the process. So there are checks and balances. For some reason, we assume incorrectly that in health, marketers are trying to sell us treatments that we don't need. The marketer is not in the room when the patient raises a concern with their health provider. The marketer is not whispering in the ear of the health provider. The health provider has the power of prescription. The consumer really does have the need to advocate for themselves. And I see countless times how an educated consumer is a physician's best partner. I have doctors who often contact me and ask me questions about approaches and therapies, not because they don't know, but they want the point of view of someone who cares about patients, who's advocating for patients. And I think that the rise of patient advocacy as a discipline is because physicians, smart physicians, recognize that the patient has the most amount of skin in the game. Now, marketers have to be objective, they have to be truthful, and they have to provide content creatively. Because when you think of a physician today's physician, there are countless approaches and treatments and countless different patient types. What's good for one patient with the same condition is not good for another patient with that same condition. People respond differently to medications. They respond differently to potential side effects. And a physician cannot be expected to know everything. It's impossible. There's just too much information out there. So a savvy marketer has to be willing to develop content management systems so that physicians who are inquiring and feel that they are great advocates for their patients can access the information. The marketer is not in the room with the physician. And actually, once upon a time, hospital systems invited sales representatives from pharmaceutical companies, medical device companies, to visit physicians sort of face to face. As that system changes and people are not in real life in the room with decision makers, somehow or another, that information must reach the health provider. And so it's critical. I'll go as far as to say it is life-saving and even dangerous for health professionals not to have access to a sponsor's, a company's information. And right. It's not going to be an excuse if they don't have access to it. So we've got to figure out what quality standards are, and we've got to make the information available.
Right. Yeah. And just looking at how healthcare workers, they need to coordinate, communicate with each other, with their patients, with all the different various providers. And there's lots of different technologies, smartphones, devices that they push around. That's part of a daily routine and a life for them. And I think, in my opinion, providers, patients, and everyone in this sort of whole ecosystem, healthcare ecosystem, they need access to mobile content, mobile apps, IoT. You talked about different devices that are sending information in different places. It's going to streamline communication processes and all these. This is the kind of technology sort of backbone that we think of. But how can we design systems that can actually work together with all this, content and communicating together that will actually help patients? I mean, I think that's the sort of thing. To me, that's a really sort of a golden question: is how can we make sure that the whole idea here is to help patients when we design these things? And what are your thoughts on that, Gil?
Yeah, first, I think that your question is a great question, and we're really talking about the rise of omni-channel information that has accessibility for physicians or healthcare providers, most certainly, and also for patients. And I think that the age where we sort of said, I'll call it the paternal medical system, where the clinician, the white-coated clinician, made all the decisions and the patient was docile and listened. That's gone. I mean, that's gone. And it needs to be gone, because when that developed, that post-World War II sort of sense of Dr. Marcus Welby, the kind old physician, sort of became a TV show of sort of popularity in the United States. There were very few medical treatments really available. I mean, up until like 1990, if you think about the major treatments for high blood pressure were diuretics and beta blockers. In the 1990s, we really saw the rise of the ACE inhibitors and calcium channel blockers. And then another wave of therapies came in. But that's not that long ago in terms of the history of modern medicine. So more and more as we become aware of and we access information, we actually do need a sort of like people to sit down and figure out how do we curate and determine accurate information. And not everyone processes information the same way. That's the challenge here. Some people love to read through studies, and some people love pictures. That's why Twitter and 280 characters is so important. By the way, Twitter is the world's second most popular search engine after Google. Think about that, right. Twitter. Yeah. So obviously we need different ways of getting that information, and we need different systems that make it work. For medicine, it's not easy. For consumers who are diagnosed with a condition often become, or their caregivers become, all consumed with knowledge about that condition. Think of someone who, heaven forbid, is diagnosed with cancer. Either they or their immediate family or friends dive into this and become kind of semi-experts in that one category of information. So having the information available is super important. I think that we have to look at various ways and technologies of making that possible. One, for people who are using sort of smartphone technologies or specialized apps on a condition. We actually need questions and prompts that bring them to different places where they can assess information. Where people who are managing their medications actually do need to understand what interacts with what. There are apps to do that. So what's happening is that we're having an explosion of information, and the explosion of information isn't necessarily helpful. It's a process to a process. Systems actually do help us with that, help us organize how we want that information. It's a challenge because actually right now the fragmentation is becoming worse, not better. And therefore I do think we need some sort of management system that makes sense and is transparent, timely, and truthful.
Yeah, and if I'm seeing a kind of a pattern here, just in my own experiences anecdotally, but also in what you're saying, Gil, is like these idea of patient portals and the idea of consolidated health records across systems that are providing information can really they could really help in terms of an omnichannel approach to bringing together the content that I need as a patient, but also kind of knowing something about me or or whoever I'm providing care for or looking up information for. It's just understanding what that actual condition is, especially with regards to all the different medications and so on and so forth that are part of that patient's history.
Joel,
do you think we can get people to start saying no to this? Stop saying no to these kind of ideas? Because I think that's a really good idea. And why isn't it happening?
It's a great idea. Look, my friend John Noss often says culture crushes innovation. And that's true. He's right. I was thinking as you were speaking and just saying, we use often hashtags as a way of sort of alerting people to sort of information that they may want to access. And I actually do think in the medical system, we're probably going to have to develop some sort of navigational system, some hashtag-like system, where if someone has a certain type of heart disease or a certain genetic disease, that they hashtag that, the doctor hashtags that. But what happens as a result of that hashtag is that they're basically saying to the world, information that is connected to that hashtag, send into my portal, please. I'm interested in that. And we're looking at this in businesses right now. If you look at email, which is almost like the general inbox of your life, and then something like Slack, which allows you to sort of be more selective. We're awash in information, totally. A former Surgeon General, Dr. C. Everett Koop, Chick Koop, once said to me, maybe, I don't know, 20 years ago, we were together, and he said, Gil, if I read every night one medical peer review article within 1 year, I'd be 10 years behind in my reading. That was 20 years ago. I would say, if he were with me right now and with you saying that same thing, he said, Gil, if I read 10 articles in my specialty every night, in 1 month, I'd be 10 years behind in my medical specialty. There's no way that we as consumers or as health providers can keep up. We are awash in information. And therefore, we actually do rely now on technological innovation to help us sort through and even prioritize that which we know. And again, going back to the story of my father-in-law and the electronic medical record, imagine if his record could be read electronically through technology and key aspects of his medical history could be automatically summarized, including important medications he's taking, and the health professionals on that floor that changed almost every day could get a one-page summary on each of the patients on their floor under their care, how much better that care would be. Technology is a solution. It's a pathway, but it does not ever replace the power of humanity to make decisions and offer really empathy and care.
Gil, that's a great closing statement, and I think I want to leave it there because I think we've talked about a lot of different points and answered a lot of different things, but most of all, we've opened up the discussion that I want our listeners today to have that conversation and to sort of continue to ask questions about their technology providers and how they can help, especially if you're a marketer in healthcare, about how the technology can help you to do that connecting, create those relationships, and to sort of help prolong the idea that, or sort of push forward the idea that our culture needs to change a little bit with regards to technology and healthcare,
Yeah.
in regards to our content.
Joel, thank you. Thank you for that. And again, I love your closing thought. Marketers are like a lighthouse. They illuminate paths that we need to consider. So I would say to you and the agility team, keep going with that. Keep helping people illuminate what is possible in improving patient care.
Awesome. Thanks very much for joining us today, Gil. And thank you for tuning in, and keep following us along for our series of webinars, and we'll continue on this topic. Thanks very much.